the first question goes as so. My mother has been having frequent headaches, trouble remembering things, and sometimes feels dizzy. Her doctor ordered an MRI and mentioned the possibility of a brain tumor. How serious could this be, and what are the next steps?
How serious it would be and what the next steps are really would depend on what the MRI shows. If the MRI shows that it is indeed a brain tumor, then it becomes a question of where is it located? What kind of tumor does it seem to be looking at the imaging? Is it something that we can clearly state is responsible for the patient's symptoms? And is it in a location that it can be removed? Is it, what is the general health of the patient? Is the patient relatively healthy and capable of undergoing the surgery? So those would be the factors that come into play in order to decide what to offer next.
Doctor, can you tell us more about the symptoms of a brain tumor?
Yes.
Like the early warning signs, so if I may specify.
The symptoms can be very variable. It is different from, say, if you have abdominal problems, a lot of people have abdominal pain. There is dealing with brain tumors, for example, a lot depends on the location of the tumor, how long it's been there, whether it's slow growing or fast growing, and whether it's on the left side or right side. So there's so many variations that sometimes we see people who, based on the MRI, have very large tumors, but it only got picked up accidentally. They hit their head somewhere, they were having headaches, and somebody got a scan, and the scan shows this very large tumor. And until they hit their head, they said that they were feeling fine. And other people can have something like a seizure, which is like epilepsy, as a result of irritation of the brain from the tumor. If the tumor is located in a part of the brain that, say, enables movement, you can have weakness on the opposite side of the body. It can also result in symptoms that can resemble dementia. They'll think that grandma is acting a little bit not like herself. Her memory is poor. Her walking is poor. Could that be dementia? And it turns out to be a tumor. And so the brain is responsible for so many things. And each of those, it's responsible for thinking, for movement, for speech, for sensation. So if you take all those things, depending on the location of the tumor, any or all of those could be affected.
And obviously, all brain tumors are bad, but what times is it that you just go like, oh, which part of the brain do you think if you find a tumor, you're like, oh, this is okay, not so bad. And which parts would you be like, oh, this is really bad. Like, I do not want this to be here.
Yeah. So generally speaking, if anyone had a choice as to which location of the brain to pick the brain tumor in, then the answer to that question would be the right front part of the brain would be the one to pick. And the reason is that it's considered the less, what is the exact word, eloquent part of the brain, meaning that you can get away with an injury or removal of that part of the brain with seemingly less symptoms after surgery. While in other parts of the brain, removing a part of it actually becomes nearly impossible because it's responsible for very important brain function. And so the reverse of that question is, if you were going to pick a location and you were going to pick the right frontal lobe, which is the part of the brain that's above the right eye, say to speak, right in this area. Where you don't want to have a tumor is especially on the left side, particularly in the deep parts of the brain.
Why do you say this, doctor?
Because the left side has a lot to do with language function,
Mhm.
and losing or having a problem with language function is very disabling for people. And by language, I mean the failure or the difficulty with speaking, with understanding, with creating language, not just the ability to speak, but the ability to even understand what you want to say, to understand what is being said to you. All that formulates really what makes us unique. That can be lost in left sided injuries and left sided tumors. And deep parts of the brain are always worse places to have anything because it's harder to get to them. You have to go through normal brain to get to them. And so, if you had a choice, again, you would like to pick something on the superficial parts of the brain.
Mhm. Mhm. Thank you so much, doctor. And what would you say is like the current like success rate of brain tumor surgeries? Like, what does the prognosis look like?
So, a lot of that depends on what the tumor is. If it is that, very broadly speaking, let's say two kinds of brain tumors. There are brain tumors that start on the surface of the brain and they grow into the brain rather like a raisin in a pudding, so to speak. It displaces the brain. And then there are brain tumors that actually are in the brain itself. They grow from cells that are within the brain. And then in each of these, they can be what we call benign, meaning they are not cancerous, or they could be malignant, which are cancerous. And then, depending on whether it is benign or malignant, also determines then the outcome. And again, the location becomes important because in certain parts of the brain, you can take all of the tumor out, which is a good thing. And certain parts of the brain, you cannot take all the tumor out. And so if you have a cancerous tumor in an important part of the brain and you cannot get a lot of it out, the outcome can be quite bad. On the other hand, if you have a non-malignant or a benign tumor in the surface part of the brain, particularly on the right side, and you can take all of it out, you can have almost normal recovery and long life after that with no symptoms.
Mhm.
So,
Mhm.
what the tumor is makes a huge, huge difference.
That's wonderful, doctor. And do most people usually go on to require chemotherapy or radiation therapies after the surgeries?
For most cancerous brain tumors, the answer is yes.
Mhm.
For benign brain tumors, usually not.
And are you consulting with an oncologist when you're operating on these brain tumors, doctor, or is it completely a neurosurgery side?
Most treatments now are a team effort, you see. So there'll be a primary care doctor involved, a neurologist involved, reasonably often an oncologist, which deals with the chemotherapy part. And then you have other oncologists, they're known as radiation oncologists. They are responsible for the radiation part.
Mhm.
And then there is the neurosurgeon. So it's all a team effort. The neurosurgeon gets a biopsy or removes the tumor so they know exactly what it is. And then, depending on exactly what it is, the oncologist and the radiation oncologist determine what kind of chemotherapy and what kind of radiation and how much radiation they need to give.
Mhm.
So it's a team effort, really.
Mhm. And going back to when you said that, most people come in, they've like hit their head, and then you go on to look at their scans and you probably come on to diagnose a tumor. So, how often do you think like normal people should get tested for us to catch tumors, especially brain tumors, earlier?
That's a tricky question because there is really no screening test. For example, there are recommendations in general healthcare that people should, like women, should get mammograms at starting at a certain age every year to early detection of breast cancer. There is colonoscopy for early detection of colon cancers and things like that. But there is no such thing for brain tumors, at least not as yet. So maybe in the near future, there may be some blood tests that may come up, genetic tests that may lead to some early diagnosis, but currently there is no screening.
Mm-hmm. Oh, well, that's a little bit scary, honestly, to hear about. But thank you, doctor, for explaining this to us.